Okay, it's live. Huh? Yep, that's the one.
John, mute your mic.
We're going to be starting the meeting in a minute, Pat.
Anthony, where are all your dogs? It's too quiet.
They're in the other room right now.
Okay.
Anybody else watch NISAC's webinar on the budget today?
Yep.
Is there any good news, Bill?
I was actually surprised. It was a little better than I expected.
It's early.
Yeah.
All right, it's 6 o'clock, Mr. Hagman. Are we ready to go?
We're ready to roll.
Okay. I'll call the meeting of the January Health and Human Services Committee to order. And before we get started, I must read this preamble. The meeting is being conducted under the extraordinary circumstances of a public health emergency, COVID-19, and under Governor Cuomo's Executive Order 202.1, without permitting public in-person access to the meeting, authorizing the meeting to be held partially or completely with members appearing by remote conference call or similar service, and the meeting is being live streamed via the web and recorded, including the participation of the members appearing by remote link. With that out of the way, we'll do a roll call of the membership.
Legislator Peck,
Here.
Ferris,
Right here.
Drake,
Here.
Nabawanik. I
Here.
didn't see Jim. Doldo,
Here.
Maxon.
Here.
Grant,
Here.
Reed,
Here.
Jarrow,
Here.
Cantwell,
Here.
Calarco, McBride,
Here.
Monticelli, Johnson,
Here.
and Gray.
I'm here.
Thank you.
Okay, one housekeeping detail next is we have the approval of minutes for 2 previous months, since we did not meet last month. Is there any changes or corrections to the last 2 committee meeting minutes? Seeing no comments, we'll assume that they're okay and move along to our resolutions.
First resolution this evening is amending the 2020 county budget relative to mental health programs, authorizing amended agreements in relation thereto.
Now, please announce your name for the motion and the second, and then we'll be doing these resolutions by roll call vote. Or no, not roll call vote.
No.
My misunderstanding. But just make sure you do announce your name for motions and seconds, please. So I entertain motion and second for resolution number 1.
Legislator Neville.
Drake, second it.
So I guess I get to choose Mr. Nabby and Mr. Ferris for first and second. Is there any discussion? All in favor?
Aye.
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 Opposed? Carried.
Next resolution is amending the 2021 county budget to reappropriate federal Medicaid administration reimbursement for the Community Services Department.
Motion Doldo.
Second.
Nemownik.
Thank you. Any discussion? All in favor?
Aye.
Aye.
Opposed? Carried.
Next resolution is amending the 2021 county budget to reappropriate funds for Veterans Peer Support Program.
Motion Doldo.
Second, Ferris.
Thank you. Any discussion? All in favor?
Aye.
Aye.
Opposed? Carried.
Next is amending the 2021 county budget to reappropriate district funding for Community Services Department.
Motion Nemownik.
Second, Drake.
Thank you. Any discussion? All in favor?
Aye.
Opposed? Carried.
Authorizing the Jefferson County Public Health Service to utilize volunteer assistance, locate testing and vaccination sites, and obtain sundry services in connection with COVID-19 pandemic services.
Motion Doldo.
Yep. And a second?
Second Nemownik.
Thank you. Any discussion? All in favor?
Aye.
Aye.
Opposed? Carried.
Next resolution is changing the membership and terms and appointing members to the Jefferson County EMS Advisory Board.
Motions, please.
Motion Nemownik.
The second?
Ferris.
Okay. Thank you. Before we get into discussion, would Director Hall or Paul Barter please give a little brief synopsis of the changes within this resolution from the last time we saw this?
Good evening. So the request to separate Fire and EMS Advisory Board is actually a good thing. They're both very distinct services and they're both very strong departments. Due to the reputation of the EMS department, they have been having increased requests for more involvement in county, regional, state activities. And with all these different and additional activities, there needs to be an advisory board that can help them evaluate these changes, not only with the department here at Public Health, but also in the community, how those changes are going to interact and impact other entities. So at this time, I'd like to ask Paul Barter, he's the director of EMS, he is also on, to elaborate on the need for the EMS Advisory Board.
Well, good evening, everybody, and thank you for the opportunity to address you folks. As Ginger has so eloquently spoken, we are really being quite overwhelmed with all of the changes that are coming out of Albany, not only due to COVID, but prior to that, the whole academic roles have dramatically changed. There is bills before the Senate right now to start to implement the integrated healthcare. That's the community paramedicine program, which is going to take just a tremendous amount of work involving, business leaders, insurance agents, because this is a billable type service when it becomes to fruition. We also have of what they call the ET3, which is emergency triage, treatment, and transport, which is in effect because of COVID. And that talks about the delivery of a patient to an alternate care level facility. That is up, that's being tied up with the insurance component as well. So there's a lot of policies, procedures, quality assurance issues that we need to get established. The educational curriculum by itself has just completely been turned around. Our current mutual aid plan is up for renewal. We also are involved with the Fort Drum mutual aid as well. And Fort Drum is on a mission at this point to try to change some of those parameters. So there's a lot of work in there. The big problem with, as you all know, is with retention and recruitment of volunteers. It not only affects the fire service, but also the EMS service. We have the just-in-time training that we're trying to keep up with. These are things such as the vaccinator programs, the testing programs that we need to have some type of assistance, guidance, and setting up these programs. Our course sponsorship for renewal is coming up this year as well, as that's ongoing changes. Our current policies and procedures are from the 90s, so that needs to be updated to reflect all the changes. You know, we need our deputy coordinators. We have a host of, well, we have the 5 zones, and we have people trying to help out in these different zones as coordinators to get them some assistance. We need our policies and procedures and all that as well. Our preceptor program to train pre-hospital and clinical providers. So we've involving, you know, hospital liaisons, some law enforcement as well. So there's a host of things that need to be accomplished. And with such a small team, myself and Chris Singleton, it's something that should not, in my opinion, should not be what we've been delicately saying the Paul and Chris show. This is something it is a county program. We need to get that county input so that everybody has a share of this office. And I mean, I could go on, but those are kind of like my top 10. But it is something that, you know, when we talk about, and I've sat on the Fire and EMS Advisory Board, and they do a great job for fire. You know, they're very prominent firefighters, but honestly, if I bring up a topic of ET3, they're going to probably think it's the third version of the movie ET. They're not going to have any concept of what this is. So to try to get those individuals involved to try to give us guidance is kind of challenging. So that's why we went to this avenue to try to get healthcare providers. And like you say, we've got a nurse, we have a supervisor from Fidelis for insurance purposes. We've got businesses, nurses, law enforcement people, as well as several different providers, business owners, to try to get that community involvement to give us guidance. And that's really, truly what we're trying to get, is to get a county EMS office that is for those providers and communities out there.
Okay, thank you very much, Paul. Is there anything further to add, Ginger?
No?
Okay. I'll open it up to discussion from the board members.
Mr. Peck?
Yes, Mr. Ferris.
That was a very nice explanation from Paul. I really appreciated it. I wasn't quite sure how I felt about it. It seems like it's 2 guys and a trying to make it happen. So I'll be supporting this. I think Bobby Cantwell's awesome to put on this. And I look forward to Bobby's input and to see if this goes through and everything works the way it's supposed to. So that was really nice. I appreciate both Ginger and Paul.
Thank you. Any further discussion?
Yeah, John, I'd like to comment if I can.
Okay, Mr. Doldo.
Thank you. Paul, if I can ask you, because I had no knowledge of this and I happened to miss that meeting, something came up at the last minute. Why was there never any discussion prior to this on the fire advisory board? It just kind of blew me away when it came out all of a sudden at once.
But what we did is at the last board, we brought it up to do this separation, just to bring it up for discussion, and it was voted through that everybody was in agreement after we did our presentation. So, you know, it was not intended by any means to all happen in that one night. It just happened to work out that way.
Okay. I mean, there must have been discussion before. And, you know, I mean, I listened to what you said and I get it. And I know there's a lot of work and stuff that goes on behind the scenes as a work group, staff level, whatever. I look at this as an advisory board to the legislators. And when you guys want to bring something together, that's where I came from, is that, you know, you guys wanted one voice before, and it was interesting to listen to both sides, myself being there, and just couldn't understand why we have two emergency services and all of a sudden they're separating. Because we are in a pandemic, we are looking out for the people in our district or in our county, and just didn't get the whole thing of what was going on and why such a decision at the last minute with nothing said prior to.
Well, excuse me, I can say that there had been several conversations about this prior to the meetings with different people, and at that juncture, they were all kind of saying this is a good idea. So we then came to the board and made that presentation that evening. I agree, but this all started back in the late summer, early fall, and it was, I want to say, October, November. I think it was October meeting that it was discussed. And like I say, at that point, they moved forward and made the recommendation and moved it forward.
Okay.
Okay. Anything further, Mr. Doldo?
No, that's it. Thank you.
Okay. Any other discussion? Okay. All in favor?
Aye.
Aye.
Opposed?
One.
One opposed?
Yep.
Okay. The motion carries.
Next resolution is accepting donations on behalf of the Department of Social Services and amending the 2021 county budget.
Ferris.
Motions, please.
Ferris.
Yep. Second.
Nebelonik.
Grant.
Thank you, Ms. Grant. Any discussion? All in favor?
Aye.
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 Opposed? Carried.
Next is amending the 2021 county budget relative to additional revenue from the Red Lake Horowitz Foundation for Child Welfare Virtual Casework.
Motions, please.
Motion, Anthony.
Ferris.
Okay.
Second, Ferris.
Yep. Thank you. Any discussion?
Yeah.
All in
Mr.
favor?
Chairman.
Oh, yep. Yes, Mr. Ferris.
is Mr. Horwitz, the Horwitz Foundation, is that something that we've received before? Is it a regular thing? I don't remember seeing it.
I can quickly respond. Actually, this is now the second time it's a private foundation has awarded some funding to DSS. Wasn't too long ago. I want to say last November-ish was the first award. But it's the first time with these two occasions that we've had the opportunity to see some funding.
Is this a local foundation? Or
No, it's a national foundation.
Thank you, Mr. Thank you.
Any further discussion? All in favor?
Aye.
Aye.
Opposed? Carried.
Next is amending the 2021 county budget relative to additional revenue from the New York State Office of Children and Family Services for Safe Harbor New York funding.
Motions?
Nebuonic.
Mr. Drake and Mr. Nabuanic. Any discussion? All in favor?
Aye.
Aye.
Opposed? Carried.
Amending the 2020 Comprehensive Planning Resource Allocation Agreement with the New York State Office of Children and Family Services and authorizing amended contractual youth program agreements in relation thereto.
Okay. Motions?
Grant.
And a
Second, Dolvo.
Thank you. Any discussion? All in favor?
Aye.
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 Opposed? Carried.
Last resolution this evening is authorizing the 2021 Comprehensive Planning Resource Allocation Agreement with the New York State Office of Children and Family Services and authorizing contractual youth program agreements.
Motion, please.
Dolvo,
Ferris.
motion.
Grant.
Yeah. Mr. Dodo, Mr. Ferris. Any discussion? All in favor?
Aye.
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 Opposed? Carried. Well, that gets us through tonight's meeting. So, it's very nice to see Ginger on the meeting tonight. I don't remember the last time I saw you either in person or virtually. So it's thank you for the hard work that you're doing on behalf of the county for us. Certainly on a sobering note, we've been seeing the reports every day, and I was just tallying up. I mean, today represents 19 deaths within the past week. So certainly that's very heart-wrenching, and obviously we still need to keep our community and ourselves vigilant of the virus that is going around. With that, is Mr. Gray still on the meeting, or is he available in case he has any new information to update us on vaccine protocols or rollout? If there's any new information today.
Well, there's going to be.
Mr. Chairman?
Yeah, I'm here.
Yes, me, Mr. Ferris, or Mr. Gray?
Actually, kind of from both of you. I had a citizen call me up, and he was asking me about the deaths that are going on and the ages of the people and where they are from. And I told him our policy of, really not putting that out there. And he brought up an interesting point, which is like in Onondaga County, they don't list names or where they're from, but they'll list the death in like 3 males, 91, 74, 56, and 1 female of 65. And he said that that would make some people feel better knowing the age group. And I don't necessarily agree that knowing the age group is gonna make you feel better. People are kind of nosy and would like to know, but I believe our policy of you know, not saying where is and assuming that everyone is sick and you're contagious is a good policy. But he asked me if I would bring that forward to the board and see if that would be some consideration to say in the deaths that happened, they were whatever age group they were at. So I said I would bring it forward and asked you as chairman of finance or health and human services and Scott as chairman to give it some consideration in front of the board.
So we've got another request also on that, Bobby, and that is under consideration. We're reviewing that right now. And can you hear me okay, Bob? You're squinting.
It's hard to hear you, Scott. You're not coming through very well.
Okay. Yep. It's this thing. That's why I'm on two. That's why I'm on two. If I do the thing, hold on.
That's an awful big close-up.
Yeah, I think I just cut off. I'm not sure. Anyhow, that's under consideration. We're looking at how to present that information in terms of a range of ages, but that's a second request that's come through for that. So Bob and I have had preliminary discussions about it yet, and I don't even know if Ginger, if Bob's talked to Ginger yet, but it's under review. So I will be honest with you, Bobby, and I'll be very frank right now. It doesn't matter what the age is. If you're a family member, it doesn't matter if they're in the 90s or if they're in the 50s or the 60s or whatever. I know that's not your point. I just hope in relative terms, we're not trying to arrive at a degree of acceptable, because zero is what is really acceptable and nothing more than that. So we're past that stage now. So, but forthcoming.
I agreed with Mr. Chairman. I agreed with your point, and I brought that point forward that we want no one to pass, and he wanted me to make sure that you understood that he wasn't trying to be morbid about it or trying to be flippant about it. It's very serious. He's in the age group that would be considered kind of right in the middle of really susceptible and not susceptible. But he said it would make him feel better and the people around him. And I said, well, if it has nothing to do with the location and it has nothing to do with the names and stuff, he sent me an example of what would happen in Onondaga County. And that is just something they brought before the board. I'm not running with this and saying I want this or else. This is something that I thought to bring forward and ask the board or ask you guys to consider it. I'm not challenging anybody on this. It's just something that I promised I'd bring forward, Scott.
Point taken. So what was the second half, John, of your vaccinations?
Yes, any new updates today on vaccination issues?
Yeah, I mean, there's 1575 scheduled for the county. Correct, Ginger? I can tell you.
That's correct, Scott.
Yep. Ginger,
Yep.
I didn't know. So let me just go back and hold on. Let me go back to, I don't even know where that email is. So there's I don't even know what this. Holy cow. In here somewhere.
200 for public health.
That is correct. Control room.
And Kenny's has a lot as being
Yes.
per location.
There's going to be more right here. Yep. So geez, hold on. Oh, somebody's calling me.
I know that's some of the issue with the pharmacies having them that I've been told about is that they'll try to make appointments with Kinney Drugs and then they end up chasing fires around the county to get to a store that has one.
So that's going to be addressed, and there's going to be an announcement on that here shortly. We had a conversation with Kinney's today. There's going to be potentially there's going to be some consolidation of the Kinney's effort under a single location, but there's more to come on that. There are Yeah, each Kinney store, if they're getting Moderna, in which it would be Adams, Carthage, Watertown State Street, they're getting 100 doses. And if they're getting Pfizer, which is Washington Street, Alex Bay, Clayton, Coffeen, and one of the locations in Watertown, they're going to be getting 195 doses. So, so there's a varying degree of what everybody's getting. Public Health is getting, I think, 200 Ginger, and I think Samaritan's getting 100. So, wait, geez, what is going on with these people?
Mr. Chairman,
Yes.
do we have the facilities to keep the Pfizer at minus 70 degrees below zero
Ginger.
between Kinney Drugs or the college or?
We had ordered a refrigerator. It's on back order. So right now the answer is no.
So, yeah, and basically it'll be the Pfizer location, the Pfizer doses that will be consolidated. They are being stored up in Governor, but they are able to be moved the day before, so they can be dispensed the following day. So they can come under a certain, they have to stay for bulk storage for a period of time in that deep freeze, whatever it is, and then they can be moved to a location and then dispensed after that. Am I correct there, Ginger?
You are correct.
Mr. Chairman?
Yes.
Yes, Mr. Perry.
My contact with the state, believe it or not, has been telling me he's trying to, I think I brought this to you, Scott, before. I'm not even sure. I did try to get a hold of Bob earlier today. He was talking to me about having the state bring down stuff to the county. Your request was trying to get somebody, buses or groups of people to be able to be taken up to St. Lawrence County. And he had called me up and he said, well, if you guys want some, I can see what I can do about getting it down to which he said, I didn't think you had the ability to store at minus 70. Our conversation was you get it figured out. So he's contacted me 2 or 3 times in the last couple of days and asked me what's going on. I simply said that I'm not in charge of this, but if you tell me that we can have 200 a day, someone will be coming up to picking them up. He said once they're out of the refrigerator, they're good for 12 hours. So I'm not saying this is happening. I just didn't want to get in the middle of something.
You can't just move it around freely like that. It's very complicated. Maybe not complicated. It's a little time consuming. Everybody's accounted for all their vaccine, and there has to be a reallocation process that goes in, and it's very tightly controlled when it moves from, even if it moved from Samaritan to Public Health, it's very tightly controlled. Samaritan cannot just take over vaccine and hand it to Ginger and say, here, dispense it. There's a process there's a step, it's accounted for, and every change of hands, it's accounted for. And then if it's sent back, and then because the other part of the process is a lot of these people have to have second doses. So, and part of the situation is the second doses have to go to the original provider. And if there's going to be a reallocation, so if Ginger gets some of Samaritan's vaccine, then the second doses really have to be determined where they're going. Who's going to do the second dose in that process? So there's not free movement of this vaccine around the North Country, and so it's fairly complicated.
I understand your point.
We are getting, just so you know, our allocating. So there's about 5,000 doses. If everybody's followed what I've been saying, there's 250,000 in the state on a weekly basis. Our 2B population is 2% of the statewide total. So we get allocated 2% of the 250,000 doses, which translates down to 5,000 doses. That is for our region. So 5,000 doses. So you can follow the trickle down. 5,000 doses come to out of the statewide allocation, which is allocated by the federal government, and we get 2% of that, or 5,000 doses. That is for 7 counties. That 5,000 doses, And then if you take, there's probably 30 to 35 pharmacies, Ginger, if I'm not mistaken, throughout the 7 counties. And so each one of those, there's a baseline minimum that each one gets. They don't send out 40 doses or they don't send out 60. The bottom baseline is 100 doses. So with rounding, we may be up in that many pharmacies, we may be up to 6,000. But in any event, 30 some pharmacies are going to chew up 100 each. So you can see the trickle down, and then Ginger's, then public health departments across 7 counties have to get them, and then hospitals have to get them across 7 counties. So you can see the trickle down and why somebody like Ginger's only getting 200 doses.
Is there a simpler way to do this where it was like at St. Lawrence County where they have a state site, but we had a county site that would make more sense? I mean, there's the logistics of how you explain it and how it's been explained to me in the past is almost a nightmare for everyone to report that, to get the doses back to. It just seems almost impossible. And I think it's the state, Scott, that you told me before, that everyone has to report to the state to say what they're getting. It's not really the county is in control of it. It's kind of the state. Is that correct?
The state's in, Ginger can talk about the specifics that she has to do for reporting, which is in and of itself. You got multiple systems operating there that she's going to keep track of. You got to order a NICIS, and then there's other, I don't even try to keep track. There's CDMS, and then there's the HERD system, and it's, that's out of my territory. If she wants to address it, she can. We just to answer your question, there's preliminary. So there's been preliminary work on. So yeah, ideally, what we'd like is all the doses come into the county. And then we can, between collaborative effort between the hospital facilities, public health, we can manage this whole process coming in. But there's an allocation, and we have to, even if we do a consolidated effort or collaborative effort, they still got to be in control of who's got their doses and for reporting purposes. So there is an effort underway to, first of all, we're lobbying for either that type of effort. So it's more of a streamlined effort that you're referring to, Bobby, that is run by local people on the ground here, because we know the ground better than they do. Absent of that, we would take a state site where we could. So let's recognize that's 500 extra doses a day in our community if we get a state site. So, but we think we can do it better. Right, Ginger? She's nodding her head. We think we can do it better with our resources here, and we think we can provide better service, and we think we can do it cheaper. And we're hoping the state takes it to the next level. It's moving. The concept is moving out there, and we had multiple calls on it today, and we think it's going to take to the next level in terms of a pilot program. Ginger is responsible for that, so you should be a little pat on the back for you right there, Ginger. Virtual pat on the back. Because and Andy, who is blowing up my phone right now, Ginger. So Andy Short at Samaritan. So they're really working together to put this collaborative effort together. And then we're hoping the state will recognize that and say they do have the ability and they can deliver the services and stand us up similar to what they stand up a state site, which would be eventually getting that number of doses on a daily basis. That's the ultimate goal. Am I correct, Ginger? Incorrect?
You are correct. Right now, each one of us is exhausting a certain amount of resources with a very small amount of vaccine. We could solve all this problem if they just give us the vaccine. We could do clinics and efficiently vaccinate everyone. But we're getting such a small amount of vaccine that each one of us is using the same amount of resources for that small amount of vaccine, that if we combine together, it'll be a little bit from each one of us. the big thing will be getting, the state right now is very rigid on what populations we can or cannot vaccinate. And we really need them to open that up, because right now they will not allow the local health department to vaccinate people over 65, but we're the place they've always come to for their flu shot. So once those types of things are ironed out and we can get into the pilot mode to show that they know us, we can vaccinate them, it'll make a huge difference.
So, yeah, we have to stay, healthcare, hospitals, the 3 hospitals in the area have to do 1A workers, which are healthcare workers. There's a little latitude if you look at the language there. It says prioritize healthcare workers, right, small, prioritize healthcare workers. Ginger has to stay to primarily what we consider public sector, right? Teachers, law enforcement,
1B.
customer facing, grocery store workers, things along that line.
She said she can't inoculate to people over 65 years of age.
That's pharmacies. Pharmacies can only do 65 and up, right? And then the allocations of the doses have to be distributed by the subgroup in 2B. So 65 and up is about 52% of 2B. So 50% of the vaccinations are being directed to that constituency. That's why you see pharmacies getting vaccines. That's why you see Ginger getting a smaller amount. Hospitals even getting a smaller amount because they are penetrated 1A to a point where they're drawn back from hospitals. Samaritan was getting multiple hundreds. Now they're getting like 100 because 1A has been penetrated to a certain point where they can redirect some of that allocation. 20% has to be allocated to the essential workers that Ginger's doing, public health is doing, and then 20% has to go to 1A still. But 1A has been penetrated, and then it's the further complicated. It's based on performance. Correct, Ginger? If you don't get them in arms, if we get them in arms and we penetrate a subgroup, then it's allocated elsewhere in the state, right? In order to balance it all around the state. So essential workers are balanced all around the state. So if we are a heavy percentage of our essential workers, then you'll see Ginger getting less and it'll be allocated somewhere else. Conversely, if we're low doing 65 and up, you'll see an influx of vaccines for 65 and up. And that's why you're seeing 32% of the vaccinations through the region come to us this week. It's because we are 65 and up is a low percentage. If you look at the map that I sent you out this weekend, there's other regions primarily centered around the state sites. Clinton County is doing much better. St. Lawrence County is doing much better in that subgroup than we are. We are more distant from everybody. So therefore, that's why we're getting a higher percentage of the allocation this week. So anything, right, Ginger? Yep. Okay.
So very simple, easy.
Sure.
Mr. Maxon had a question.
Yep. Or I don't know if it's for me, so I shouldn't say yes.
Thank you, Mr. Peck. I wanted to back up to the discussion on reporting ages. I think that the pandemic is not as it was in the beginning. It's stretched on for a year. It'll be a year of emergency coming up now. It was different when people wanted to know when their neighbors were sick and did whatever they could to find out. But it's different when hundreds of people are positive every day. And we're having multiple deaths a day. And I think you said 19 this week, Mr. Peck. I think that reporting ages should be a policy decision that's made by the board. I don't think that it should be the purview of the department head or the administrator or even the chairman. I think that's a discussion for the Health and Human Services Committee and then the full board. If we do decide to report, I think that we should use the CDC weekly COVID reporting, which breaks down by year under age 1 to 4, and then the rest are every 10 years. 5 to 14, all the way up to 85 and up. Finally, I think that if we do have concerns about privacy, perhaps we can batch the reporting once a week to take 20 at a time, or hopefully fewer. And I think that it's information that the public needs to know. Certainly, everyone knows that there are many, many people coming down with COVID. As we've heard for weeks now, the state expected to peak in February, and it looks like that is very much coming true. But until it's over with, I think that it is information that is federally reported. It's information that state reports, and I think it's information that we should consider reporting as well.
Thank you, Mr. Maxon.
Anthony's got his hand up.
Mr. Doldo.
I was just waiting my turn. Just a question, the dosages that come to us, does that include for Fort Drum, or do they get their own allocation?
They're separate. They're under a federal program. They're
Oh,
separate.
okay.
Yep.
Okay. All right.
They're separate and doing, they're a little deeper than we are.
Yeah. No, that's okay.
I missed the call today, but the last time I knew, they were heading to 1C. Yep.
Yeah, it makes a difference with the dosages in that, number of people that they have out there. It makes you wonder, is it going to take that much longer for us because Fort Drum's included, or if they're getting their own and people have a better chance. With all these different, go ahead.
No, actually, military, and then the military dependents, contractors that are on Fort Drum working, anybody that's inside the gate working as a contractor is eligible to be vaccinated on Fort Drum, and retirees are eligible to be vaccinated on Fort Drum. So here's my simple thing what I tell people. I said, if you're able to shop at the commissary or the PX, then you're able to get vaccinated there. Rule of thumb.
Okay. And with all these,
that alleviates
go ahead.
That alleviates us a great deal. That's all. Yep.
Gotta love virtual. With all these different vaccine sites and stuff, Scott, is there just one place, New York State, for people to register on? I know there's some registering to go up to Potsdam in March. But how is that working if there's some more dosage available here and they're able to shift to Watertown rather than travel up here? What's the best thing to tell them?
So there's the state sites. So there was I think it was AMI eligible, and it was through the Department of Health website, and you could go on originally, and you could, it was 65 and up, I think. You had to determine if you're eligible, and then it would give you the sites that are doing it, and then it transitioned over to the site. So all the Kinney stores were listed there. Bolton's Pharmacy was listed there. Anybody that's vaccinating over that. When the state stood up, and it was originally 13, but I saw today it was maybe 18 now. I think they were stood up 18 of them. Now it's just registering for the state sites. Mind you, it's not just Potsdam. There's Utica and there's Syracuse also. People are traveling from all over the state to go to those sites. I mean, Potsdam is drawing out of Long Island and a lot of up northern New York, but they're drawing from all over the state. People are going wherever they can get an appointment. They're traveling to. So the Ginger has to do her own scheduling for her essential workers, healthcare 1A. That's part of when people say I'm complaining. That's part of what I'm complaining about, is that we have a very fragmented approach here. The essential workers and 2B have to go to Ginger, have to get registered, and have to get vaccinated there. If you're a healthcare worker, you have to sign up with a healthcare facility. And if you're 65 and above, you got to scatter around to whatever pharmacy you can get into, right? And it's a crapshoot, basically, whatever pharmacy you can go to. So with our centralized approach, if we can do a collaborative approach, there'll be one central point of entry. And people will come in, people will get registered, and you don't have to have internet access. It'll be by phone or internet access. We'll have a registration process, and we will we will follow the metrics that the state gives us, and we will make sure that we're dosing accordingly with a much more simplified entry system.
Yeah, I guess that's part of my question is, you know, do you go to the state website to sign up, or do you go to public health and sign up? That's where the confusion is.
Well, you're absolutely correct, Anthony, and that depends upon, that's exactly right. People don't know where I'm going, who's doing it, or, you know. So if you want to go to a state site, you go register online. If you and if you're one of the other type of workers, you have to go to that. We hope to get over that hurdle within maybe a few days. We get some answers.
Yep.
We hope to get over that hurdle quickly. So it is fast tracking, I would say, and actually, I will tell you, it's being received in a positive manner. I'm not sure positive is the right word.
Yeah, not really.
They're listening.
It's being warmly received. How's that sound?
Okay.
So I think to be able to boil down our situation, you know, we're still dealing with, you know, the fact that, you know, we're living under executive orders, we're living under social distancing, and as far as our organization, we're fighting on the front of contact tracing and healthcare being stretched thin, and trying to coordinate a vaccine program. So we're fighting on multiple fronts.
Yeah,
So,
let me back up, John. When you say we're living under executive orders, because it's broader than that. We're living under we're still living under a state of emergency, right, wrong, or indifferent. Anybody can debate it. I'm not debating it. I'm just what I'm saying out there is that the county has remained under a state of emergency. The state is under a state of emergency. The executive orders, much like are under the Article 2B, you know, authority for the governor, much like the same that is possessed in the office of the chairman of the board, regardless of the person. So that's really, we're living under a state of emergency still, public health state of emergency.
yeah, that would be the more appropriate terminology that I was searching for that I did not utter. So thank you very much.
You're welcome.
But, you know, it's just the bottom line. We still just need to be vigilant, and we have a lot of work to do ahead of us. I think that's the bottom line, is that we've got a lot of fires and fronts that we're fighting on, and it's all for the betterment of our neighbors and our community. So thank you very much for all of the information, Mr. Gray. Is there any further discussion or other items to come before the committee tonight?
Motion to adjourn, Doldo.
Thank you. Is there a second? Okay. Thank you very much. We are adjourned.
Don't go far.
And in regards to supply for vaccine for JCC, I think this weekend. Well, I'm going to give him your phone number, okay?
Mike, are you there?
He appears to be on the phone.
Bobby appears to have some microphone problems.
Mike is having some microphone problems. I'm working with him.
Yeah.
Okay, thank you.
Why don't we just have him sign out and sign back in?
I would love to step in his chair, Scott.
I think we got through to him. So we'll see.
Hopefully it works.
I did so well, I hung up on myself.
Well, if we need to, a plan B could be to deputize our vice chair to chair a meeting.
You asking me that, Don?
I'm just talking for the good of the order.
We have a phone number that Mr. Monticelli could call in on.
Yes, there is.
We're working on that now.
Perfect.
And I think I'm on.
You're on.
You're on.
Okay, hang on just a second. I have to now go get my paperwork from another part of the house. Thank you, Greg.
Amazon just made a delivery for him. Mr. Chairman, I have to ask, why do we have two cameras? That's kind of freaking me out.
This shouldn't freak you out. It can never be enough.
Oh, well, we can certainly get enough of you, Mr. Chairman.
Give him the answer, legislator Gerald.
We can certainly get enough of you, Mr. Chairman, all due respect.
I got a piece of masking tape over both of them.
It won't work. It'll take duct tape. I can infiltrate anything. Oh, let's not admit him.
All right. Okay, if I could ask the Finance and Rules Committee to come to order for their January meeting. Anybody able to hear me?
Rock, you're good.
All right. Okay, so I have a couple things to do before we start the meeting. One is to read the preamble. The meeting is being conducted under the extraordinary circumstances of a public health emergency and under Governor Cuomo's Executive Order 202.1, without permitting public in-person access to the meeting, authorizing the meeting to be held partially or completely with members appearing by remote conference call or similar service, and the meeting is being live streamed via the web and recorded, including the participation of the members appearing by remote link. So that's the preamble. Then I'd like to apologize for being on a different machine, and now I apparently am in. I went from my laptop to my iPad. Okay, so preamble's done. Could we have roll call of members?
Absolutely. Legislator Monticelli,
I'm here.
Calarco, Nabawanik,
Here.
Johnson,
Here.
Drake,
Here.
Cantwell,
Here.
Jero,
Here.
Doldo,
Here.
Reed,
Here.
Maxon,
Here.
Ferris,
Here. Here.
McBride, Grant,
Here.
Peck, and Gray.
I'm here.
I'd like to thank the folks who are hanging in for this meeting, who aren't on the committee. And then I'd like to move to approve the November 4th and December 1st minutes, which I was reluctant to bring for approval. Any additions, corrections, deletions? Hearing none, they'll stand as presented. And now, on to the Finance and Rules sponsored resolutions number 1, please.
First one this evening is amending the 2021 county budget and capital plan to recognize 2021 revenue from Fort Drum Residential Communities Initiative.
Would you please state your name when you first or second the motion? May I have a
Jero.
motion? Jero,
Cantwell.
thank you. Any discussion on the motion? Hearing none, all in favor?
Aye.
Aye.
Opposed? Carried.
Next resolution is amending the 2020 county budget for sales tax distribution.
May I have a motion, please?
Johnson.
Nabawanik, second.
Discussion on the motion? Hearing none, all in favor?
Aye.
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 Opposed? Carried.
Amending the 2021 county budget in relation to Samaritan Senior Village Incorporated.
Motion, please.
Cantwell.
Drake.
Discussion?
Yes, Mr. Chair.
Yes, Legislator Nabawanik.
Thank you, Mr. Chair. Just a question, maybe Bob will know. Is this our last payment, Bob, to Samaritan for the Whispering Pines deal?
Jim, that's a great question. We have one more year to go. 9 down and 1 more to go.
Well, just a comment though, I mean, so we're almost to the finish line, talk about the years passing, but the decades, but I'll just say this, Bob, that in today's difficulties with this pandemic, I can't imagine having that adult home and still being in that business, so. I guess
Absolutely.
blessing that we got out of that business, gave it to the professionals like Samaritan, and this $5 million payment, which really essentially allowed them to take over and merge our residents into that new facility, brand new facility at the top of the hill. And it also, you know, when you leverage $32 million at the time was the biggest health grant from the Department of Health in New York State. And also the facility there in Meadowbrook over by the Carthage High School. So I thought this was the last, but it's the next to last. So just as well. Thank you.
Thank you, Legislator Nabawanik, for that bit of institutional knowledge, because I don't, I look at Samaritan Village and I just don't stop to think about, oh my God, what if we own Whispering Pines? So, the good news. Any further discussion? Hearing none, all in favor?
Aye.
Opposed? Carried.
Next is concurring in settlement of tax certiorari proceedings and authorizing refund of taxes in connection therewith, which would be Jefferson LeRae LLC, Northview LeRae Associates, Essex Evanstown Associates, and Conifer Realty.
Motion, please.
Gerald.
Second. Is there a second? Is there a second?
Drake.
Hopefully that was recorded. First, I think Johnson was first, but Mr. Drake offered a second if you didn't hear it. So, any discussion? Hearing none, all in favor?
Aye.
Aye.
Opposed? Motion carried.
Amending the 2020 county budget in relation to employment and training department.
Motion, please.
Gerald.
Cantwell.
Thank you. Discussion on the motion? Hearing none, all in favor?
Aye.
Aye.
Opposed?
Aye.
Next is amending the 2021 county budget in relation to employment and training department.
Motion?
Drake.
Second, Gerald.
Discussion on the motion? Hearing none, all in favor?
Aye.
Aye.
Opposed? Carried.
Authorizing appointment to the Jefferson Lewis Workforce Development Board.
Motion, please.
Cantwell.
Second, Nebelonik.
Discussion on the motion? Hearing none, all in favor?
Aye.
Opposed? Carried.
Reappointing member to the Regional Fish and Wildlife Management Board.
Motion, please.
Gerald.
Johnson.
Discussion on the motion? Hearing none, all in favor?
Aye.
Opposed? Motion's carried.
Reappointing members to the Jefferson County Industrial Development Agency.
Motion, please.
Cantwell.
Nebel.
Discussion on the motion? Hearing none, all in favor?
Aye.
Aye.
Opposed? Motion's carried.
Next is appointing Director of Office for the Aging.
Cantwell.
Cantwell, second.
Gerald.
Thank you. And discussion on the motion? Hearing none, all in favor?
Aye.
Aye.
And opposed? It's carried. Number 11.
Expressing opposition to the closure of New York State's Watertown Correctional Facility.
May I have a motion, please?
Drake.
Second, Nebelonik.
Discussion on the motion? Hearing none, all in favor?
Aye.
Opposed? Motion's carried. Number 12.
Supporting New York State Senate Bill 8466, Assembly Bill 10546 of 2020.
Have a motion, please?
Gerald.
And a second?
Johnson.
Nebelonik.
Discussion on the motion?
Yes.
Mr. Drake?
I'll be opposed to this. I understand where it's coming from. I really don't know if there's a need, because for me, what I'm thinking is there's only what we can do to stop this pandemic, and that's distancing, social distancing, mask, tracing, and now the last part of the clue will be the vaccine. And from what I gather, it won't be till June until we get everybody vaccinated and have maybe this pandemic somewhat under control. I know it's raised havoc economically, and I know the lower end of the level of our society by all the people who are lined up to get food, and the people have lost jobs. But to me, I think that we under a state of emergency, and I know that the governor has made mistakes, but I just don't see a need for this at this time. And there will be a time that he will have to give up his powers, and then I probably would be in favor of something like this. Again, I'm going to vote no. And just one last thing. Being a man of my age, I had the privilege of listening to some of those people of what Tom Brokaw called the greatest generation. And when they talked about what they sacrificed on the battlefield in World War II or at home, giving up materials such as nothing could be made because all the factories are taken over by the government to make war materials. They had at home, they had to give up sugar, gas rations, etc., etc. They spoke about it with pride. They weren't bragging about it. And they did it because they knew it had to be done. It was for the community, because it was an all for one. And some of these people were anti-Roosevelt, but they didn't degrade Roosevelt. They didn't run him down. And I'm sure they didn't have signs on the side of the road that said F Roosevelt. I just think we need to tone things down. Thank you.
Thank you, Legislator Drake. It was good to hear from you. Good points. Any further discussion? Hearing none. All in favor?
Aye.
Aye.
And opposed?
I oppose.
Thank you. Okay. The motion is carried. The next is I'm going to do these as a block unless I have somebody like to pull out one. Anybody have an objection to doing them as a block? General Services sponsored resolutions? Okay. Mr. Administrator, can we do them as a block?
You certainly can. We're all about efficiency.
Okay. So just the General Services resolutions, is that how you'll read it, or just?
Yes.
Okay, so all in favor?
Aye.
Aye.
And opposed? Well, okay, 2 votes, but it sounds like it's carried. Okay, Health and Human Services, any objections to doing that as a block? Seven resolutions. You just heard them from Legislator Peck a few minutes ago. Okay, could we move those as one then? All in favor of the Health and Human Services sponsored resolutions?
Aye.
Chair.
Aye.
Okay. Did I leave anybody want an opportunity to discuss it? Did I leave anybody out? Okay. Opposed? Okay, they are carried. Thank God for that. Okay, we're doing good. We're on to just departmental reports. And is there anything from the floor from any members? Anything to bring forward to the committee? Hearing none, I'd entertain a motion to adjourn.
Cantwell.
Thank you. And who else? Cantwell and
Gerald.
Thank you. All in favor?
Aye.
Aye.
We are adjourned. Thank you, one and all.
Have a good evening.
Likewise.
Good evening, everybody.
Rock on with your bad self.